Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
And good Monday morning, everyone. Thanks so much for joining us here on Journey Through Parenthood on the WSAZ Now Desk. I'm Martina Bills. Today's topic we're going to be talking about, October is SIDS Awareness Month, which SIDS is Sudden Infant Death Syndrome. And it's a topic that's a little hard to discuss because there really isn't a true cause that pediatric doctors can come up with as to why these babies actually pass. And this is any death of a baby under 1 year old usually happens in their sleep, and it's pretty much unexplained. So we're going to hear from a pediatric nurse practitioner at SOMC for a little bit more about the topic and some safe sleep practices that really help. And with all the baby gear on the market, it's kind of confusing to know exactly what's safe and what isn't. So Stacia Boyer is going to have a little bit about that, and then we'll come back and discuss what she tells us about. We're going to start with the basics. Let's explain to everyone exactly what sudden infant death syndrome, or SIDS as most commonly referred to, actually is.
Yeah, this is a super important topic. This is something that we address at almost every visit, it seems like, during this first year of life. So SIDS is any unexpected death of a seemingly healthy baby that's under the age of 12 months. Most of SIDS deaths occur when babies are sleeping. So instantly we think of SIDS, we think of sleeping. Babies who die of SIDS likely have a problem waking up when they are not getting enough oxygen. So and it's hard for us to research because, number one, they're babies. You can't exactly say, hey, why is this happening? And they answer you. And then number two, anytime you do research in pediatrics, there's a lot of ethical implications. So, having the opportunity to research babies that have experienced this is less than with adults that experience known causes of death. So our thought is, with research, is that, babies just almost forget to breathe while they're sleeping. And then their oxygen drops and we have the situation.
It is kind of confusing because there really isn't a root cause that a medical professional actually can pinpoint when this does happen. Let's start going over by what would that safe sleep practices be? That's a tongue twister there. What would some be that you actually recommend? I know that when my child was an infant, newborn, you watch them in their crib, are they breathing? What would be those safe sleep practices?
Yeah, and this is something my colleague, Dr. TJ Sidham, he has kind of coined the phrase, don't pimp your crib. So basically we need baby to be by themselves in a crib bassinet pack and play, something that is safe, that is flat, firm surface. We don't like cushy surfaces. We don't like bumpers, crib bumpers, even the mesh ones. Mesh ones have become really popular lately because the thought is that baby can breathe through them if they get their face up against it. And even those are discouraged by the American Academy of Pediatrics. No blankets in there, no pillows. The baby can be swaddled in a thin swaddle blanket as long as it's a tight swaddle, or even the ones that are pre-made, like the Velcro ones or the ones that zip. Those are encouraged because that reduces the Moro reflex and can help with sleep. And those are safe because babies cannot get them over top of their faces, but nothing else in that crib or bassinet with them. And the flat surface is something that's really important. It's something that the American Academy of Pediatrics has actually brought up this year because elevated sleepers are actually becoming super popular. So if you look back, all of them have been recalled now, all of them, because they're being used inappropriately. They're not safe when you, as the parent, guardian, caregiver, are going to be sleeping as well, because babies do not have the neck tone that adults do. And even adults, when we fall asleep, we lose muscle tone and can easily lose that control of our head that tips forward and can cause asphyxiation. So elevated sleepers are strongly, strongly discouraged. Another popular thing are the fun nest things that babies feel comfortable in, like the DockATot, the Snuggle Me Organic, things like that. And those are strongly discouraged as well. Nothing should be in that crib or bassinet with baby. And they will even have a warning label on them because they're marketed for sleep. So it almost gets confusing for parents because it's like, hey, these are telling me that they're great for my baby to sleep in. But truly they are not. They even say on the product, not for use or in crib or bassinet.
Yeah, and I feel like those kind of products might be better geared. I'm envisioning like when I was trying to get a shower as with a baby,
Yep.
and you wanted the baby to be close to you. They could be right there on the bathroom floor when you're in the shower, or cooking in the kitchen type things. They're not actually sleeping.
Yeah, absolutely. I had one. I had a DockATot, and I used it for naps when we were moving around the house and I was watching her. And even the elevated sleepers, I put my baby in an elevated sleeper for naps. I didn't put her in there for it. If she fell asleep, I was okay with it because I was sitting there watching her. Now, if you're going to leave the room to go exercise, no, baby should not be in any of those. But if you're right there in the room watching closely, that's okay. That's what those are used for. But they are being recalled because people aren't using them correctly.
Okay. Stacia, let's talk a little bit about, which I know that it kind of does get tricky to explain, but what would be some risk factors for sudden infant death syndrome? Obviously, the crib stuff, but what would other risk factors with a child's health or anything like that?
Yeah, absolutely. In the research that we have done, we just look for trends, and that's where we kind of pinpoint these risk factors. And the trends that we have seen are infants that are low birth weight, preterm, or that are multiples in one birth. The multiples is because most likely they are low birth weight or preterm, because that's just kind of how it goes with multiple births. But these infants are more likely to have a smaller brain size. A smaller, more preterm brain is less likely to be mature enough to have that, hey, I need to wake up to breathe again. So that does put them at a higher risk. Smoke exposure. Believe it or not, smoke exposure during the pregnancy and as a second hand after delivery too. Some research has shown that if a mother smokes even one cigarette per day while pregnant, this can increase the risk of SIDS after delivery by 50%. So that is something that is, very straightforward that can decrease the risk of SIDS. And then after delivery, smoke exposure, a secondhand smoke exposure increases the risk of SIDS because it increases the risk of upper respiratory infections, which affects breathing, which can increase the risk of SIDS. And then last thing I think of is, there's two things, but babies between the ages of 2 and 4 months are where we see this experience the most, because it's almost like you get really comfortable. Okay, we've settled into a routine. It's almost like we lose our precautions. We get really lax on that. Plus, babies experience sleep regression at that time, so we might even try new things that aren't safe. And then overheating. Babies should be wearing one layer more than what you wear yourself, and overheating can increase the risk of SIDS as well.
What about the gear that's marketed to, there's some monitors. You can put one under like a sheet where your child sleeps or attached to the foot. Do you recommend those? I mean, where do those come in line? I know that it can be nerve-wracking. Is my baby breathing while they're sleeping? You don't really want to wake them up necessarily if you don't have to. Where do those new products that are marketed for that, idea come in line?
These monitors don't have to meet the same requirements that our professional hospital-grade monitors do. So therefore, they're not as accurate. And they're getting more accurate as new models come out. I'm not saying that, but they're still not going to be as accurate as the ones that we use here at the hospital.
When the baby's actually sleeping in a bed with an adult,
risk of SIDS more than doubles. Honestly, some studies have showed that the risk of SIDS triples if you co-sleep. And the thought is, I need baby to be right here so I can watch and protect so closely. And, I'm a mom. I've experienced that I need baby to be right here feeling. And I'm not going to lie, we're all human. I woke up a few times and baby was in my arms and I had been asleep and I didn't even remember that happening.
And Stacia, I guess the main, important note that I think that I picked up on in this interview, which I really appreciate, was the safe sleep practices and what your coworker said, don't pimp the crib. And I know it might be hard because people say, oh, the baby's cold, or oh, that's not comfortable laying flat. But that is really what you need to keep in mind.
Yeah. And one of the newer things that I have really been pushing with the parents that I guide, and this is something that worked for me, I think having my education super helped. I always knew I wanted to be in pediatrics. Having my baby just absolutely skyrocketed the advice that I can give to parents. So I really utilized pick up, put down, because one of the most common things I hear is they hate their bassinet, they hate their crib, they hate that. They only want to sleep in my arms. And think about it. That baby was in a nice warm jacuzzi, tightly bound, heard your heartbeat all the time for 9 months. And then now all of a sudden you're gonna tell baby to sleep in a flat surface that's cold. I don't blame them for not liking it, but they can get to the point where they tolerate it and they are comfortable that way. So pick up, put down, pick up, put down, pick up, put down is what I always encourage. Baby's not going to like it, but they can get used to it. So if you put baby to sleep, lay them down, they cry, pick them up. Don't sit down. I mean, you can occasionally, I get that. But if you want to kind of train baby, don't sit down, calm baby back down again, get him asleep again, lay him back down. Do that over and over and over and over and over again. Eventually, they get the habit, they get the routine. Babies thrive on a routine, and they get to the point where they can sleep in their bassinet or crib.
And we are back here on the WSAZ Now desk. A really good conversation with Stacia Boyer, a pediatric nurse practitioner for SOMC. We're talking about sudden infant death awareness, syndrome awareness. We refer to it as SIDS. And it's any unexpected death of a seemingly healthy baby under the age of 12 months within that first year. Some things that Stacia spoke of that really, stood out to me is the crib, the safe sleep practices. You think your baby's uncomfortable laying on a flat mattress, but the flat mattress is the safest. And also nothing in the crib around them. No blankets, no stuffed animals. If they're swaddled, the swaddles you can buy with a zipper or snaps are safe, or if you know how to swaddle, the baby can't get that blanket over their face and suffocate. Also, the elevated sleepers that you see so much marketed these days, DockATots and those kind of brands, those elevated sleepers most likely have been recalled. They're not recommended for sleeping. Now, if you put your child in that to keep them occupied and safe while they're, say you're cooking dinner, that's what those things are actually intended for. But something Stacia Boyer mentioned that, I found very interesting, the pick up, put down method. When the baby wakes up, you're tired. It might be the middle of the night. You haven't even gone to sleep and the baby's waking up again. The pick up, put down method helps them kind of train to get used to going back down instead of co-sleeping or something else that may not be safe. So we're trying to just really keep the baby safe in the crib for that first year. Their neck tone their muscle tone in their necks is not fully developed, so they can't really lift their head up if something were to come over their face, so to speak, and possibly do the suffocation. But some of those risk factors that she talked about for sudden infant death syndrome, and again, it's very tricky because there's no specific cause pinpointed through research over these deaths, but low birth weight, if your baby is very small, or if they are preterm, or if they're one of multiples, because most likely if you're born as a multiple baby, you may have that low birth weight. And the other thing is the risk of the exposure to cigarette smoke, whether it's while the mother's smoking while pregnant or afterwards, the secondhand smoke can really affect a newborn baby. So a lot of things to keep in mind to really keep your baby safe during Sudden Infant Death Syndrome Awareness Month and throughout the year if you do have an infant at home. And of course, here on Journey Through Parenthood, we're always looking for suggestions on topics and things to talk about. You can always reach me on social media. Here is my social media. You can find me on Facebook, Instagram, and Twitter. You can drop me a message there with some ideas you have for future Journey Through Parenthood subjects. And like always, we really appreciate you joining us here every Monday and Wednesday morning at 10 a.m. for Journey Through Parenthood. We hope you have a great Monday.